Last week, one of my patients had a stroke. There was no pain, no warning, and no symptoms. One day, he was completely fine, and the next day, he couldn't speak properly. His only mistake was that he ignored his blood pressure. Hi, I'm Dr. Michael Anderson, and today I want to talk to you honestly. No fear, no exaggeration, just the truth about high blood pressure. Because if you're over 50, there's a strong chance that you, or someone you love, is dealing with this right now. And most people say the same thing to me. They say, "Doctor, I feel fine. I don't feel sick." But that's the problem. High blood pressure doesn't make you feel sick. It stays quiet until it suddenly isn't. High blood pressure is called the silent killer for a reason. You don't feel it, you don't see it, and you don't hear it. But every single day, it is slowly damaging your body. It puts pressure on your heart, your brain, your kidneys, and your eyes. Imagine a water pipe in your house. If the pressure is too high all the time, the pipe becomes weak, it cracks, and one day it bursts. That is exactly what happens inside your body. Over time, your blood vessels become weak. That is how heart attacks happen. That is how strokes happen. That is how people suddenly lose their eyesight. And most of the time, people are shocked. They say, "Doctor, I didn't know. I felt normal." Yes, because high blood pressure hides. Now let's talk about numbers, because numbers save lives. A healthy blood pressure is around 120/80. That is good. That is safe. If you are often seeing 130/85, 135/88, or 140/90, that is not a little high. That is a warning. That is your body asking you to pay attention. And if you are seeing 150, 160, or higher, you are playing with fire. I'm not saying this to scare you. I'm saying this to protect you, because early action can prevent disasters. Now here's the good news. You do not need expensive treatments. You do not need extreme diets. You can start today, not next month, not next year, today. With simple habits. First, let's talk about your morning routine. When most people wake up, they grab their phone, check messages, check the news, and get stressed. Don't do that. Instead, drink one full glass of water before coffee or tea. Water helps your blood flow better. Then go for a walk, just 15 to 20 minutes. Not fast, not exhausting, just comfortable walking. Around your house, in a park, or on your street. Every morning, this small habit lowers blood pressure more than most people realize. Second, let's talk about food. This is where most people struggle. Too much salt, too much fast food, and too many packaged meals. Chips, instant noodles, frozen food, and takeout push your blood pressure up every day. Instead, eat more real food. Fruits, vegetables, beans, fish, nuts, oatmeal, and brown rice. Bananas, spinach, and tomatoes help your blood vessels relax. And please, taste your food before adding salt. Most people add salt out of habit, not because they need it. Give your tongue 2 weeks to adjust, and you will be surprised. Third, let's talk about stress. Stress raises blood pressure every time. When you are angry, worried, or anxious, your body tightens and your heart works harder. So take 5 minutes every day. Sit quietly, close your eyes, breathe in slowly for 3 seconds, and breathe out slowly for 3 seconds. Do that 5 times. It calms your nervous system. It lowers your pressure. It works. I have seen it. Now let's talk about sleep. Many people ignore this. Bad sleep means high blood pressure. If you sleep less than 6 hours regularly, your heart never fully rests. Try for 7 hours. Turn off screens early. Keep your room dark and quiet. Your heart repairs itself when you sleep. Think of sleep as free medicine. Next, check your blood pressure at home. Get a home monitor. They are affordable and easy to use. Check at the same time every day, preferably in the morning before breakfast and before medicine. Sit quietly for 5 minutes, then measure. Write it down. On paper, on your phone, anywhere. Patterns matter. One high number is not panic. Many high numbers are danger. Now, one important thing. Never stop your medicine on your own. Never. I have seen people say, "I feel better, so I stopped." 2 months later, they are in the emergency room. Natural habits help. Lifestyle helps. But medicine is sometimes necessary. Taking medicine is not weakness. It is responsibility. It means you care about your life. Let me tell you about another patient. He was 62. He had high blood pressure for 10 years and ignored it. He didn't like pills and didn't exercise. Then he decided to change. He started walking, changed his food, and took his medicine. 1 year later, his blood pressure was normal. He had more energy and better sleep. He told me, "Doctor, I wish I started earlier." Don't wait. Be the person who starts.